Good morning. Today I'm going to discuss about a very common problem that a lot of you suffer from. A lot of you come to us, orthopedic surgeons, go to the general physicians, go to the physiotherapist with this problem. It's a chronic problem sometimes, not really solved properly because a lot of fallacies in the treatment, a lot of fallacies in the diagnosis. So we'll try to keep things simple. We are going to talk about the rotator cuff today. Now, what is this rotator cuff? If you look at the shoulder joint, if I take off the big muscle, this is the deltoid muscle in the front, the big round muscle. And if I take this off, suppose I've taken this off and I look inside, I see these four structures. One, so I'm looking from the front. 1, 2, then I go back, 3 and 4. So these four muscles or tendons are surrounding the joint, shoulder joint, all around below this big thick muscles, and these four muscles are called the rotator cuff muscles. So it starts with the subscapularis below, the most important of them, which is mostly injured, supraspinatus, which is here. The supraspinatus continues from here, it starts from here and then goes here into the bone. Then you have the infraspinatus, which is at the back of the shoulder. This is the back of the shoulder, and you have the teres minor. So we have the subscapularis in the front coming here into the bone out here. Then you have the supraspinatus coming here up to the bone out here. Then you have the infraspinatus coming here, and you have the teres minor coming here. Now all these are important. All these muscles, all these rotator cuff, important for certain movements of the shoulder joints, like movement from here to here, movement from here to here, movement from here to here, and they are the delicate structures of the body because rotator cuffs are not very strong. 1 and 2, rotator cuffs are not very vascular. They don't have much of blood supply. So as a result, because they are not strong, they tend to get easily injured, torn, degenerated, that means rubbed on. And because they have less blood supply, the healing process is extremely slow. Another problem is the rotator cuff lies below a bony prominence out here. So this is your collarbone, and this is the bony bone out here, which is called the acromion, which is a part of the clavicle, the triangular bone out here. Now this acromion has got a small space which is called the subacromial bursa out here. The problem is, any problem in the rotator cuff, especially the supraspinatus and the subscapularis, it presents as a swelling around this area. As a result, the subacromial bursa is no more there. The space is gone. And whenever the patient is trying to raise his shoulder, this swollen area goes and gets impinged out here, and the patient has difficulty in movement. Okay. Now, if we are treating rotator cuff synovitis, rotator cuff degeneration, rotator cuff tear, we usually prescribe certain very basic exercises. Now, remember, rotator cuff tear sometimes may be related to frozen shoulder, but it is not frozen shoulder. So, exercises for frozen shoulder is completely different from exercises of rotator cuff. Now, a lot of people, unfortunately, whenever they get a rotator cuff tear, they come to me saying that I have had a frozen shoulder and I did exercise with frozen shoulder and my pain increased. Now that is a problem because you were not supposed to do those exercises in the first place. So for rotator cuff tear, it is initially, or rotator cuff degeneration is initially, we wait for the inflammation or the increased blood supply to come down, and then we start the exercises. The exercises are not frozen shoulder mobilization exercises. Step by step, one step at a time, we start. Now, how do you go about it? If the patient has come with a rotator cuff injury or rotator cuff degeneration with severe pain, we initially give the patient a little bit of rest. Sometimes we give an arm sling also with a bag to keep the patient, to make the patient keep the shoulder like this, so that he or she gets rest on the shoulder for a couple of weeks depending on the pain. And once the pain comes down, we start rehabilitating the shoulder. So how do you start rehabilitating the shoulder? This is something which is common to frozen shoulder. Suppose I'm talking about my left shoulder. So I'll initially, after 2 weeks, when the patient has less amount of pain, I'll tell the patient to do a little bit of pendular exercise. In pendular exercises, you bend your body forward and this arm is absolutely free, absolutely loose and limp, just like a pendulum. And so I tell the patient, just as if you are swinging a pendulum weightlessly, bring your arm forward, backward, forward, backward, forward, backward for 20 times. Then you do a clockwise, same way, pendular, like, without any weight, without any pressure, 20 times, and go back to anti-clockwise pendular exercises 20 times. So you start with this. Couple of days, stick to this. 3 or 4 days. Once you feel that your shoulder is better and you can easily manage with the pendular exercise, then we go on with your TheraBand exercises. TheraBand are the rubber bands which are easily available. You can buy once you start your shoulder rehabilitation program. It's easily available online in the sports shops, in the medical shops, in the orthopedic shops it's available, and from then on, after the pendular exercise is over, these are the exercises which will show you are supposed to be done. From the first, we are going to start, especially if it is the supraspinatus and the rotator cuff which are present outside are injured, what we try to concentrate is on internal rotation. So this movement is called internal rotation. So we are trying to do internal rotation strengthening exercise. So you don't need to have something so complicated like this. You can just have a simple TheraBand. You know, those green color band is absolutely okay. A green or black color band. Black is more tougher than the green ones. So you can buy a green TheraBand, and then you tie it around a bar or some rod around here, and have it round here from your body. This angle is round about 45 degree. From here to here it is 45 degree. So from 45 degree, after your pendular exercise is over, you bring the shoulder from 45 degree to neutral. Hold it. 1, 2, 3, 4, 5. So you are basically putting your elbow on the body, letting it go at 45 degree and bringing it in. 1, 2, 3, 4, 5. Bring it back. 1, 2, 3, 4, 5. Bringing it back. 10 times. Finish. Then the next exercise comes your adductor exercise. This was the internal rotation exercises. So your fulcrum, your apex is on this part of the body, or if you find that you're having difficulty in putting that, what I can do is I can use a towel or a roll something to make this fulcrum a little bit larger, so that it will be easier for me to rotate the shoulder in. I can use this, the internal rotation movement. Okay? Here, hold it, counter 5, let it go. Let it go. 45 degree, almost to 0 degree or a little bit inside, let it go. Don't give too much of stress. Little bit of stretch, little bit of stretch. Stretch is what is required. So this goes with the internal rotation. The second exercise that we add after the initial pendular exercise is this one, where the rubber band is kept a little bit higher, you know, at an angle. And we are going to do the adduction exercises. Now what is these adduction exercises? Adduction is basically pulling it inside. So from an angle of 45 degree, we bring it inside towards the body, 0 degree. 45 degree, go back, we put it in at 0 degree. 45 degree, go back. Do not put any stress while going back. Let the rubber band do its work. Let the rubber band pull you back here, and then you bring it in. Okay? 0 degree, go back. Repeat 10 times. Do it gently so that you are just stretching your adductors. This movement is called adduction. Now these two exercises are mainly meant for the commonest problem that occurs in the shoulder, in the rotator cuff, that is the supraspinatus and the subscapularis. Supraspinatus being the commonest one. The tear of the supraspinatus among all rotator cuff is the commonest one. So these are the rehabilitative exercises for the supraspinatus especially. Now after this, after the first week, once you have finished this, then you can start your supraspinatus stretching exercises. For this, you are neutralizing the supraspinatus, you are countering the supraspinatus with the other muscles, with the other rotator cuff. Now, once you are better off from the next week onwards, you can do this exercises, where what you are trying to do is you are going to lift your supraspinatus acts from this angle to this angle. So keeping it like this, your rubber band, your TheraBand like this, you can elevate your supraspinatus up to 30 degree and bring it down. Lift it up for 30 degree, bring it down. lift it up for 30 degree, bring it down. 10 times. Now these 10 times can gradually, as I said, 10 times once a day, but gradually, once you feel better, you can do it 2 or 3 times a day. You can do in 2 sets, 10 times, take a break, do not repeat the whole day. Once you feel better, 10 times, do it twice a day. It all depends on how much you're able to do and how much pain-free you are. You will feel the gradual improvement. And all the other movements, once you have strengthened and stretched these shoulder muscles, the rotator cuffs, you will feel better, and then probably you will be able to do all your mobilization, overhand movements, lifting up the shoulder up, lifting the shoulder. But that comes gradually. I'll try to show you today the initial exercises, what you are supposed to do, what we call is rehabilitation of the rotator cuff. It is not the same thing as doing a frozen shoulder exercise, no? Like swinging your arms here and swinging your arms there. That's what a lot of people do, and unfortunately guided by people, some physiotherapists who really don't know what they're dealing with, and they mislead the patient to do certain exercises, which brings worst scenario to the rotator cuff. This was about the basic exercises. So keep this in mind. Whenever you have rotator cuff tear, this is how we rehabilitate, and then gradually we take it on from there. Thank you.